this video, I'll be talking about the pros and cons of nursing. Welcome to my YouTube channel. If it's your first time seeing my face, I'm Pretty Pin and welcome to my YouTube channel. I'll be starting with the pros of nursing, which is the advantage, the merit, the good reason, whichever way you want to put it. So the first on my list is relocating easily. Like being a nurse or studying nursing can make you relocate easily. Relocate, I don't mean jackpot, don't get me wrong. What I mean is that if you're a nurse in the UK, you could easily wake up one day, take your normal, exams like ENQUIRES and, register under that country, NMC, and start practicing there. You would wake up one day and decide that, I want to become, I want to work in US, I want to work in Canada, I want to work in Australia, New Zealand, and you just write your exam and do your registration and just move. So to relocate is going to be easy for you. Like to move around the world is going to be easy. If you want to practice in Saudi Arabia, if you want to practice in Dubai, it's just going to be easy for you. So one of the advantage of being a nurse or studying nursing is that you could go anywhere in the world and practice, because nursing is the same. Because nursing is the same thing everywhere, like the same thing. So you could just wake up and decide to move to another country. So definitely is a plus to nurses out there and to people studying nursing. Another one is there is always demands for job. Like everywhere in the world, every country, both developed and developing countries, always seek the need to have nurses, because tell me, like, who saves life? So there is always need, like the demand is high. Let me tell you, like every day, like every single day or every single calendar year, there are always numbers of nurses, qualifying to join the registration or the NMC bodies. But the same thing, at the same time, like nurses are not enough. So there's high demand. So what does that mean? You're not going to tell yourself one day that, I don't have a job, because there is always a job for you. So, and that is a plus. Another thing on my list is flexible schedule. Like being a nurse or studying nursing will help you have a flexible schedule. If you're a nurse, you're going to work 3 times in a week and have 4 days off. That means when you do your 3-day shift, you're guaranteed that in 7 days of the week, you're only going to walk through the corners of the hospital for 3 days, and you're going to have 4 days to yourself to rest, except you're one of those people who do extra shit. So yeah, but you have 4 days to yourself to rest and get all the strength that you need and all the relaxation that you need, which is really, really good. Because you definitely, like, what are you looking for? It's definitely a plus. Another thing on my list is good career progression. With nursing, you can decide that you want to progress in your career, and trust me guys, nursing gives room for career progression. Like you would say, okay, you would say, I'm an A&E nurse, I want to become an AMP, I want to do this, you just want to grow in that, you just want to grow in your career, and nursing is open. It's open. You want to become a prescriber, you want to become an advanced nurse practitioner, it's open for you. Like there is no limits. There is no limit to where you can break through. There is so much door. You just have to push yourself. You just have to go. As long as you want to get it, you can get it. And nursing gives you that career progression, that pathway to push to wherever you want to. And it's a plus. It's a big plus. Like what else are you looking for in a career? It's a big plus, guys. A very big plus. A big plus for that. Another thing on my list is there are many specialties. There are many. Let me tell you, you can never be bored with nursing. That was something I would tell you. You can never be bored with nursing, because there are different specialties. So maybe as a newly qualified, you might decide to start on a cardiology ward. ward for 2 years and you want to progress and move to another ward, or move to neurosurgical, or you want to become a surgical nurse, or you want to become, an ICU nurse, or you want to become, like any kind of specialty you want to go into, mental health, God, let me tell you, there are so many specialties in nursing: heart failure nurse, wound care nurses. You just want to specialize. You can't be bored. There are so many specialties. The world is your oyster. Just take it. Like, guys, that's one thing I love about nursing. You cannot be tired. If you want to become a dementia nurse, look in charge of older adults, the room is there for you. Go just specialize. Be the best in what you're doing. Another thing on my list is getting ready for work is simple. As a nurse, as a student nurse, we all know that we only wear scrub or tunics, and it makes life easy. Like, to dress up to work is very, very easy. Just iron your uniform and move on. But when you're in a corporate environment, you have to be like, wear a suit, wear your tie. But with nursing, just scrub up. Scrub up. Just put on your scrub or put on your trousers and tunics and just move. So one thing I really love about nursing is that dressing up is so simple to work. Like, I feel like let me tell you, the amount of time I spent when I used to work 9 to 5 was like, it took me time to dress up when I used to do 9 to 5, than now that I am a student. And it's like, it's so easy. Like, I just dress up quickly. Like, I just put on my trouser, put on my tunics, and I'm off. Like, there is nothing too much to do. Like, if that makes sense. And it's a plus. It's a plus. Another thing on my list is being appreciated. As a nurse, you will see families, you will see patients who appreciate you, who will tell you thank you, who will be happy for you to save their life, because everybody knows that nurses save life, healthcare professionals saves life, and some people will be very, 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 very thankful. We do have some people that are not thankful, like they don't appreciate, but let's just leave those people aside because they don't exist. Let's look at people who appreciate your effort, who says thank you, because trust me, nurses, doctors, healthcare professionals are really doing well. And I know many times on my video where I shout out to them, because trust me, they are really doing well. I know that, yes, I am not yet a nurse, or I'm not a doctor, or things like that, but I'm a student nurse and I work in the hospital. I would say I am a healthcare professional, and I know how it feels when I appreciate nurses that are doing well. I do that when I see nurses that are really doing well. I walk up to them and I tell them, you are doing a great job, and I know that. Seriously, I don't know where your reward is, but you'll be rewarded. Whichever way, you'll be rewarded. But thank you so much. You're doing very, very well. Anybody who watched my video and you're a nurse and I have really appreciated you, you definitely know, because I do that a lot. Like, when I see nurses that are good, nurses that are wonderful, I appreciate them, because trust me, guys, the job is not easy, and we really need to appreciate people who saves our life. Like, I go to the GP, I go to the hospital myself. Do you understand? And I meet nurses, and the way they treat me, the way they talk to me, they don't even, most of them don't even know that I'm a student nurse, except if they've seen me before, and maybe because I'm putting on my sweater, and sometimes maybe I'm on placement and I have to attend the appointments. But apart from it, they don't know, but they still treat me with kindness, with empathy, with so much joy in them doing their job, smiling. It's not easy to put on a smiling face for 24 hours or for 12 hours of a shift. Trust me, guys, it's not that easy, and these people do it, and they do it perfectly. So we need to appreciate them. Yeah, we need to. Last but not the least is, I feel like one of the advantages of being a nurse is that it changed the way you do things. Yes, I would say. Even as a student nurse, I think I've said it on this channel before, there are many things that studying nursing has done for me. Like, it changed the way I think, it changed the way I do things, it changed the way I would perceive some certain things. Let me tell you, my judgment, not just clinical judgments, my judgment and decision making on things are a bit more critical, because I have to think it through before I make decision, and I have to place priority. Like, it just changes the way you think. Like, it brings out that part in you that you never knew that exists, like that empathy part, that part that you have to always be professional. Trust me, you don't have to behave like what I don't know, but you have to be very professional. So I would say that there are so many merits of being a nurse or studying nursing. And if there's anyone you think that I did not mention, and you're a nurse, you're a student nurse, and these particular things have, you know, influenced your life positively, and you think they are advantage to someone who is studying nursing or who is a nurse, you can kindly leave it on my comment section and let us see it together with you. At this point, I'll be talking about the cons of nursing. I mean, the disadvantage, the demerits of being a nurse or studying nursing. The first on my list is underpaid. I can't even talk about this. Like, everybody knows that. I feel like nurses are not being paid, you know, are not being paid to the extent that, you know, like compared to the work that they do. I feel like nurses needs to be paid more. And seriously, it's not something I would start talking on this channel, because it's something that has been talked about years and decades ago. So I don't think there's anything I would say that will change anything. So if you're going into the profession thinking that, you know, you just want to make the whole money in the world, rethink, because trust me, nurses are not being paid enough. I would say there's some countries that pay nurses well, so you should just check that yourself, because that's not what I am about to talk about in this channel. Another thing on my list is emotionally and physically stressed. God, let me tell you, one disadvantage of being a nurse is that you will be stressed out. Physically, emotionally, psychologically, anything stressed, you will definitely be stressed out. Burnout. Like, go online, you see articles of burnout nurses. Like, seriously guys, like, you will be burnout. Like, I would not see being a student, like, I am burnout. Like, I get tired, I get stressed. I would count how many times for almost my 2 years of studying masters in nursing I have cried the hell out of my life. I have cried, I've questioned myself, I've asked myself, Jesus, like, are you sure I want to do this? At some point in your life, you're going to question yourself this kind of thing, because trust me, it's going to suck out your blood. No day is ever the same inside the hospital. No day is ever the same when it comes to healthcare professions. No day is ever the same. Maybe you come in today and you're like, oh, today it's good. Tomorrow it's going to be fire. Hey God, you will not even understand, because it's going to drain you physically, emotionally. You will ask yourself questions, like, and there will not be evidence to those questions, because you will explain, tired, no evidence, because you'll be tired. Seriously, I'm not even talking about, I know nurses that have cried. Like, I know nurses that, I don't even want to talk about it, because I've been on a shift where you're not to be on a shift and she'll be crying. She's stressed. It's not a child's play. So me as a student nurse, if I don't cry safe ahead of time, so that you go on the shift, and it doesn't just you don't understand. You're stressed. You're asking yourself. I remember. Let me just give you guys a quick story. 2 months ago, I was on my placement 9, which is my sign-off placement, and I was writing my dissertation at that period. Guys, I don't want to explain to you guys the kind of stress I was going through. Every day I come back home and I am crying, and I'm asking myself, Jesus Christ, are you sure I'm going to go through this stress? I have to report to placement by 7 o'clock in the morning, and I finish at 8 or 8:30. I can't remember, 8 or 8:30, one of them, but I cannot remember, because every ward has their own time. Some wards I've worked in the past, 8 o'clock, some is 8:30, but I know it's one of them. And I'll get home. After getting home, I will shower. After showering, I will lie down on my bed. Guys, definitely, I don't even lie down on my bed, because at that point, I even stopped going to the gym because I was stressed out. Because normally, when I come back from placement, I just go to the gym. But I stopped going to the gym. I will just have my bath, shower, come out, and I'll bring out my laptop. I'll start working on my projects. Like, I'll start working on my dissertation instantly. So I have to be awake till 2 o'clock. This is like from 11 to 2. So I have to devote 3 hours of my time. Then I'll make sure that by 2 o'clock I'm done with whatever I am doing. I'll have to close my laptop. I'll start sleeping, and I'll have to wake up 6 o'clock in the morning. So I always have 4 hours sleep. Like, I was at some point, because that placement was 7 weeks or 6 weeks, I was struggling, but there was no time dissertation was there. I need to write my dissertation. Like, you know one graduate, you know one pass. Like, tell me how you're not going to write your dissertation. So I was, you know, at some point, like, I don't even want to use the word devastated. I was just down. I was just a shadow of myself because I was struggling. It's like the whole 24 hours of my life, I only have 4 hours sleep. And the struggle, like, it's easy for me to say it now, but guys, it wasn't easy that time. I was crying. My friends will come and be like, oh, that they don't even know how they are coping. Sometimes I'll be on the phone with my close friend Becca because she'll be writing her dissertation. I'll be writing, and we'll be on the system. So we'll be on the system on our laptop till 1 o'clock, and we'll be like, you know what, we have placement the next day. Let's just go and sleep. And imagine, in a week, you have to do 40 hours for placement, non-paid. You get it? Non-paid. So it's not easy. Guys, it's not easy. You are going to be emotionally stressed. Let me not even be saying long story. I'm just giving you an example. Like, I'm giving you my own life story. Like, you're going to be stressed out. Another thing on my list is, guys, just forget about weekends, bank holiday, Christmas. You're not going to have those holidays at all. You are not, because you're going to be working weekends. If you're rota to work weekends, you will work weekends. If you're rota to work on bank holiday, you're going to work bank holiday. Christmas Day, New Year. See, let me tell you, forget it. Like, I will talk about NHS. There's something we call golden shifts. So those golden shifts are like Christmas, New Year Eve, Boxing Day, and New Year Day. So you have to pick 3 golden shifts, and they will allow you to do just 2. So whichever way you want, you have to decide between that 4. 2 that you are going to do. This one, they will give it to you on a platter of gold. Pick. So what is it? Be like, oh, I'm going to celebrate my Christmas, my New Year, but witnessing. It doesn't work that way. You have to do all patterns of shifts, and seriously, it's really not fair at some point, but that's what comes with the job. Another thing on my list is long hours. Like, guys, like, you don't even understand what it means to stand for 12 hours. Like, keep working for 12 hours. Maybe now I'm used to it, but it's not easy. Like, you start 7 o'clock and finish 8:30 or 8 o'clock non-stop. Man, it's not easy. It's not easy. Like, it's not easy. So it's like a disadvantage. So if you're considering doing nursing, you should look out for things like this. Another thing I'll talk about again is physical demand. With nursing, there's so much physical demand. Like, you're going to be doing lifting, you're going to be doing manual handling, you're going to be doing so much. So it will need physical, it will need physical demand. But trust me, like, with the NHS, they really help you and train you on your manual handling in order for you not to hurt yourself. But trust me, the number of nurses that have back pain is too much. Even me, that I'm talking, like, God, it's not like I have back issue. I don't have back issue. But sometimes I feel pain on my back, like, and I used to go to my GP because of it. Like, I've spoken to my GP like once because of pain. You're going to have pain because you're going to be physically stressed out. Like, it's not easy. You're going to be physically stressed out. Sometimes you don't even know when you do those things. So you need to be like, in as much as they'll be like, your manual handling training needs to be top notch. Your bending, lifting, almost sometimes, sometimes, let me tell you guys, sometimes the world will be chaotic. Like, things happen so quick that you don't even know how you bend. You don't even know how you lift, because things are really happening so quick, and you want to, like, save somebody, so you're not even going to be minding your back position, your bending position. But sometimes you take note of those things, but sometimes that's just the truth. Sometimes you don't. It's not you. It just happened because you're rushing to save somebody. The least thing that will be on your mind is like, oh, I want to position properly. Let me tell you guys, I don't know whether it has happened to somebody, but I've seen myself in a situation where I've been working around the hospital for 12 hours non-stop without even resting my leg except my break time. It does happen. It might not happen always. Trust me, you can be on a shift for 3 days and it will happen those 3 days. And maybe the next week it might happen 2 days, and one day you'll be be safe, but it does happen often, and there's nothing you can do. It's part of the job, and it's part of what you signed in, and you just have to do it. So it puts it as a disadvantage, but it's part of what you signed in. Like, if you, this is why people like me are making this video, so that when you see things like this, you have to reconsider your decision. You have to weigh the advantage, weigh the disadvantage. Is it what you really want? And then you go in for it. The last but not the least is virus exposure. Like, guys, you know, with healthcare profession, we get to see lots of body fluids, lots of infections, and you know, sometimes we have to wear complete PPE and all that, and it's not easy. Like, it's not easy. Someone might cough, you might be doing, you know, a turn, and then someone might just like spit or vomit, or you know, have you ever, like, I don't know what, have you ever worked with a patient on trachea? Like, seriously, I think that's like I had to learn how to defeat that fear, because God, I have had an issue where I was really traumatized because of it, practically rolling a patient, and this, I don't know how to, I don't really know. If I have a picture of what a trachea look like, I will put it on the screen. And then this trachea just came off, not like came off properly, but the cover came out. And this patient like tried to cough. Definitely, the patient cannot like cough because there's like, this patient was intubated, and you know, everything. They will have to like suction the patient and maybe suction the trachea. Jesus, guys, if you see the fluid that came out, like it slitted in the whole room. Thank God that we were putting on like complete PPE, if like we're wearing like the whole eye shade and everything, because I think it has happened a day before, and that is why they made it compulsory that everybody had to wear like the eye shade and you know, the whole thing. See, God, guys, I was traumatized. Like, it took me, do you know, at that point, like, I was just like, okay, just imagine you're not putting on the right, like, you know, there are some people that even if they say you need to wear complete PPE, they'll still be asking you why. Better, if you're part of those people, better stop. I'm just saying, so better stop. Like, someone like me, let me tell you, if I'm going to turn a patient and the patient is in a side room, like, I will ask you, why is this patient in a side room? Because sometimes the patient is in a side room because there's no any other bed, so they have to put the patient on a side room. So during handover, that's why it's always good to listen attentively during handover. So I will understand, I can go on, but I will not go. You don't tell me that this patient is having this. This patient is having this virus or not this, or this infection. I am putting on my complete, like double, triple complete PPE. Because I cannot risk myself. I cannot. Since that time I've been really traumatized because of it. I always, even where I'm not even supposed to wear full PPE self, even if you tell me that this person has this, I will just wear PPE. I'll just say, see, let me tell you, prevention is better than cure. Let me just prevent. So things like that can make you like feel a certain kind of way, but that's what comes with the job. Like, that is what comes with the job. Guys, I'm sure you guys be hearing me saying all these things and you'll be like, but you're a mental health student. I'm a mental health student, but I bank in a general hospital. So yeah, that's just, I'm a bit weird, but I'm just the kind of person that I love to go around, see how things are being done in different places. So at this junction, we're done with today's video. I hope you guys enjoyed it. I hope you guys are able to see the merit and demerit of being a nurse, doing nursing and studying nursing. If you really love this video, give it a thumbs up, like, share, comment, subscribe, and do all those good things, guys. And I'll see you guys in my next video. Bye.